In this video, we are going to talk about why monitoring blood pressure is an important part of self-care for heart failure.
Monitoring blood pressure is important for two reasons. The first reason is that good blood pressure control is important for preventing worsening heart failure. The ideal blood pressure is not clear, but the systolic blood pressure should remain under 130 mm of mercury at least and maybe under 120 mm of mercury.
The second reason is that many heart failure medicines lower blood pressure as a side effect. Dizziness due to a low blood pressure can limit increasing heart failure medication doses. This is why you should check your blood pressure regularly.
You should start with checking your blood pressure daily. Daily blood pressure measurements are useful when first diagnosed, recently hospitalized, or adjusting your medications. Once stable on the same medications, it is reasonable to check your blood pressure less frequently and when not feeling well. For measuring your blood pressure, use a validated monitor. Ask your healthcare provider or pharmacist for help. In the 30 minutes before your blood pressure is taken, do not smoke. Don't exercise. Don't drink alcohol. And don't drink caffeinated beverages. For 5 minutes before your blood pressure is taken, sit still in a chair. Right before your blood pressure is taken, make sure the cuff is the right size. Wrap the cuff just above the bend in the elbow. And make sure to wrap it against skin, not over clothing. While your blood pressure is being taken, relax. Don't talk. Rest the cuffed arm comfortably on a flat surface, like a table, at heart level. Sit upright, back straight and supported. And keep legs uncrossed and feet flat on the floor. If your blood pressure is abnormal, wait 1 minute and recheck it. Try to keep a journal and bring it to every checkup. Have your healthcare provider check your monitor annually.
Checking these blood pressures regularly will help your clinical team understand if it is safe to continue increasing your heart failure medications to get your heart stronger. A common question is whether a blood pressure reading is too low. The blood pressure that is too low varies from one person to another. Many patients with heart failure feel fine and tolerate systolic blood pressures, or the upper blood pressure number, in the 90s or even 80s.
If your blood pressures are lower than usual and you feel unwell with dizziness or fatigue, reach out to your clinical team.
Measuring blood pressure regularly is an important part of managing your heart failure. This will help you and your clinical team monitor the safety of your heart failure medicines.